Hello and welcome to the Oakland County Megacast. I'm Tyler Kieft.
And I'm Dave Scott. Tyler in our West Bloomfield studios. Today I am in our Troy studios, and we thank you for joining us all across Oakland County on some incredible radio stations like 89.3 WBLD in West Bloomfield, Orchard Lake, Keagle Harbor, Commerce Township, WBFH 88.1 WBFH The Biff, from Bloomfield Hills and beyond, and we're awful glad to have WAHS, Avondale Community Radio 89.5 FM with us today. We thank you for joining us on our television stations around Oakland County as well. It's Birmingham area television, covering communities around Birmingham, Civic Center TV, covering communities around West Bloomfield, Keagle, Sylvan, and the areas. And you can catch those on Channel 15 if you're a Comcast subscriber. If you're an AT&T subscriber, you can watch us anywhere. Really, just go to Channel 99. You'll find the municipal government television channel there, and click on any of our communities and you will see us. Our live stream on civiccentertv.com. Watch us there in full high definition. And thank you to the West Bloomfield Township Clerk's Office. Each and every day we stream live via Facebook from a partner page, and today it's a clerk's office. And Debbie Binder, the township clerk, doing a great job over there and having thousands and thousands of followers with her Facebook page. She is quite the social media maven. So we thank Debbie, and we thank all of you that are tuning in via that outlet today. So we have a busy program today. We're going to continue our efforts to get to the bottom of the unemployment issue here in the state of Michigan. Something is ringing in my office. It's my phone. Okay. Are you guys hearing that ring?
We are, just a little bit. We're hearing that ring, yes.
Somebody left their... Hold on a second. Hang it, Tyler.
Oh, okay. Dave's going on.
Somebody left their cell phone in my office. All right, well, maybe you can send a text, Larry, to somebody here in the building and see if they can come in and pick up their cell phone. Sorry for, whatever happens.
Live radio.
It's community radio and community television, my friends. Listen, on the show, we're going to talk to State Representative Cheryl Kennedy in just a minute of the 48th District. And Cheryl is the middle school principal in Walled Lake, so a lot of you in Walled Lake know her. But we're going to find out what's going on in Lansing and a number of issues, not the least of which is our favorite issue of the last couple of days, and what's going on with you and your unemployment check, especially if you have not been getting it. John Fitzgerald, the Chief of Police in Keagle Harbor, checks in. We're going to talk to our Michigan Secretary of State, Jocelyn Benson, later on in the program today. Eric Wallace, the president of Henry Ford Hospital in West Bloomfield. And then, my goodness, what a distinguished group of guests we have today. Jeff Cranston checks in. He is the Director of Communications of the Michigan Department of Transportation, the Fix the Damn Roads Department. They will be here, and they got their hands full, as does everyone in the state of Michigan, Tyler, with all the challenges. And we have had a tsunami of challenges lately, and then it's going to be a tsunami, if you will, of a financial crisis, trying to work through all these problems with limited dollars, Tyler.
Yes, and then as we all know, in Michigan, there's 5 different seasons. You have the 4 regular weather seasons, but then there's also construction season, and it's been put on hold because they're in close proximity. They're sharing a lot of tools, and you can't do that during the coronavirus pandemic where you're worried about transmitting the disease. And then you go into, like you said, the funding issues. Everything's enduring cuts right now. How's that going to affect Michigan's transportation department?
Well, and not only do we need to fix the damn roads, we got to fix the damn dams too. So, I mean, it's a very complicated challenge going on right now. The phone has been extricated from my office, so there'll be no more ringing on the air. A very embarrassed staffers leaving right now. So, all right, well, let's move along. We have a lot to get to today. We are also going to talk, and we get a couple of minutes, Tyler, just to discuss whether or not people are being maybe a little too lackadaisical with their day-to-day activities of mask wearing. I have mine off to do the radio show. hand washing, and other activities, we are now beginning to see some spikes in other states, not here in Michigan, but spikes in other states. Are we doing everything we can? And are we reminding ourselves every day that the coronavirus is still here and present in the state of Michigan? We'll talk about that. Patiently waiting through all this is State Representative Cheryl Kennedy of the 48th District. Representative Kennedy, thank you for joining us again here on the Megacast.
Thanks for having me.
No, it's good to be good to have you with us. 48th District, can you let our listeners and viewers know what communities you serve?
Sure. So I serve Genesee County, but not all of Genesee County. Essentially, I'm the northern and eastern boundaries of Genesee County, so that does not include the city of Flint. My area is more suburban and rural.
All right. Well, we normally don't have representatives from foreign districts, but you are a homie for us because you were the principal of one of the schools in Walled Lake. So we'd have you on anyway. But thank you so much for caring so much about Oakland County and taking a couple of minutes for us. So
Sure.
Last couple of days, we've been talking about, in particular, one of our very good friends who was laid off in very early March, and still, as of today, has not received a penny in unemployment money, even though she definitely deserves it. And worse than that, we can find no simple, easy remedy to help her get that money. So we are working through it. She made the phone calls as any individual in her predicament would do. Call after call after call, not getting anywhere. Finally, I think the unemployment office called her when she was, with her kid or something, or doing something else. I can't remember. And then no more contact. And she kept calling. So she just didn't pick up the phone at the right second.
Right.
And no communication. So what we suggested she do is, and we did it together, we called her lawmaker. And we were told off the air, because we got some friends in Lansing, such as yourself, we were told off the air that under a normal situation, you might be able to help out. But right now, even folks like you cannot easily get answers from Michigan's unemployment agency. Is that what you're experiencing as well?
So my suggestion to folks like that who are struggling with that is, yes, first, absolutely send an email to your state representative, because it's still going slow, but it does at least help that you're talking to an actual person, and that we can get your concern in writing. And we have a form we call a CRT form. And I know my Oakland County reps are going to hate me for putting this out there, but we have a CRT form that we do provide to unemployment. And that means that form gets in front of real human eyes. And it does, the jury is out if it makes the process any faster, but I believe my constituents were able to get their issues resolved a little bit faster, because we've filled out nearly, I think last count, about 600, 700 CRT forms trying to get people connected to unemployment. And most of those folks have had their unemployment issues responded to. But then, you can't make this stuff up, a Nigerian gang decided that they were going to take advantage of our country's unemployment system and created this whole user fraud. And I actually been a victim of that. So I actually got a letter in the mail that said, we've stopped payment on your unemployment because of, the situation. I'm like, well, that's not good, because I never claimed unemployment. So, so even if people were in the system and getting their money, now there's another problem, because they have to wait for the letter, and then they have to upload more identification, and each of those identification claims have to be viewed by an actual person. And when you consider that our unemployment claims we went through, when the unemployment first hit, we went through the same number of unemployment claims in a week that we had gone through the entire previous year. So we're not happy as legislators with the answers that we get from unemployment, which is we're doing our best, we're hiring more people, we're doing our best. Even if that's the truth, the problem is that it's not enough. and I know that unemployment is hiring another 500 more folks for their office from some of the CARES Act dollars that we just got, but those people have to be trained. And the issues that we're dealing with, unfortunately, because of the federal rules, we can't like shortcut them. We can't say, well, we're just going to ignore that because we know we're in a pandemic and we know that most of you are straight up and need this money. So we are not happy either. I do have to say that my colleague, Flint Representative John Cherry, put an amendment into the CARES Act dollars bill that just went through appropriations to allow people to apply for a short-term loan through the state treasury at the same amount of money that they should be receiving unemployment. And then once their unemployment dollars kicked in, that would just, go to repay back the loan in order to kind of create a bridge for folks. So at least they have money to put food on the table. And unfortunately, that amendment was not taken up by the majority leader of appropriations. And I felt that was unfortunate because it wouldn't cost our state anything to do that. And it would have provided at least a little money for people to put food on the table until the state and their unemployment office gets their act together.
All right, so, joining us right now, State Representative Cheryl Kennedy of the 4th District. Representative Kennedy, I appreciate all that. And listen, you are not the enemy. You're on our show. You're our friend. You are a principal in Walled Lake. We got to like you anyway, okay? So thank you for being here. It's just very frustrating. The numbers that we have, over 2 million people are on unemployment or have filed for unemployment in the state of Michigan. Many of them have not received a penny since way back in March. And then we have this fraud dilemma that is going on now, and that's another 350,000 people. Now, it's interesting that you were caught up in that fraud case, but as unfortunate as that is, you're employed. So you didn't need to file unemployment. So they didn't take unemployment dollars away from you. But I am sure there are people out of that 350,000 who are getting their unemployment check and now they're not. So I'm sure that's the case. And we heard yesterday about this computer system that is there in the state of Michigan that helps manage this. And it sounds like it is it's turning down 93% of the cases. It's a mess. We can get into that, but we spent an hour talking about it yesterday. Thank goodness for the folks over at the University of Michigan who have a program over there to help people. Thank you for recommending that people do send a letter to their lawmaker. I'm glad to hear that those letters that have gone through your office have been responded to. But I'm sure listening to us right now, there are tens of thousands of people in Oakland County alone, if not more, that are not getting their unemployment checks. And to me, and the loan idea is a good idea, but to me, we got to do something. This is a crisis. The people that are most affected by the coronavirus and are walking around without money, and I'm not picking on you, I just want you to know. But when this fraud thing showed up, first of all, a lot of people never got their checks in the first place, like our friend Lauren. And then other people get turned off or aren't getting their checks because of the fraud thing. And on the fraud issue, if there is fraud of the state of Michigan, that's not the unemployed's fault. That's if it's anyone, it's the state's fault. It's really the fault of the person who's committing the fraud. By the way, one other side note on that, we talked to the West Bloomfield Police Department yesterday. They said they have 20 active cases just as of yesterday that they're investigating on fraud. So we get this is a huge problem. But is it fair for the state of Michigan to say, okay, we know we have this fraud problem, so we're just going to turn off unemployment for 350,000 people until we decide what mechanisms we can put together to fix it?
Yeah, I struggle with that because I know that when I talked to my former employer, Walled Lake, who also contacted me and said, hey, we got notice of this, 3/4 of the claims that came to them because they come in batches, 3/4 were fraudulent. So we could be talking about, I mean, we're looking at a huge deficit in our state to begin with, and then you're talking about billions and billions of dollars, tax dollars that aren't going to the people they need to be going to, and we can't get that money back if it's fraud. So my biggest concern is that people have access to resources, so that number one, make sure you're reaching out to your state rep or your state senator, because we are there to help and we can connect you to resources, even while you're waiting for this nonsense to work through itself. We want to make sure that we don't have people hungry. We want to make sure we have people losing their apartments or their homes, or we want to make sure you have access to gas money to get to work. And we also have access to community resources that can help you out during this time, because it is what it is. Even though you and I can both agree that it should have never been that way, it is what it is. So in the meantime, we have to help people in any way that we
All right.
can.
Well, the one thing I'm going to do is I'm doing everything I can. I'm taking an awful lot of my show, and we should be talking about the coronavirus. But in all reality, this is a coronavirus issue as far as I'm
Absolutely.
concerned.
It's a CARES Act. Yep. And it can be handled with CARES Act dollars for sure.
So to me, I know it's a problem and I know it's a mess, but I can't think of anything other than keeping people alive right now that could be more important than getting this done. And I don't see no offense to the governor.
Mm-hmm.
She's got her hands full. I would not want to be the governor right now. And I'm not going to sit here and pick on the governor in this show. But, there needs to be a lot more noise about this story. I'm not seeing it reported as much as it should. We've seen isolated little tidbits. And, there should be people in Lansing going crazy talking about this and finding a solution. And does it seem like there's a lot of conversation in Lansing about this? Because we don't hear it back at home.
Right. So I can tell you that whenever we're on a caucus call, this is the conversation that takes up the majority of our calls, at least in the Democratic caucus. And we do not believe this is okay. We are not happy with how things are going. And we have been, in the House side at least, we have been pushing back big time with UIA and the governor's office, saying this is not acceptable. And it's been through that pushback that we have seen additional, folks hired and trained. And but we are the ones that are listening to our constituents calling and crying on the phone and threatening self-harm because they're at the ends of their rope. And our poor staffers, we're worried about their mental health as they're dealing with this 24/7, day after day. It is very real to us in our offices. I'd love to see media. I'd love to see more media attention on this, because honestly, as you know, policy follows the people, not the other way around. And if media really picked this up and started focusing on this as strongly as they have on the virus itself and on other issues, I can guarantee things would move faster.
All right. Well, we don't have the biggest voice. We've got our community TV and radio stations in Oakland County, but we know some people, so we're going to keep making calls. Can we keep your number and keep you involved in this effort? Because anybody that we can get involved is helpful. And I know it's not easy, and I'm not. This is not a partisan show. I don't pick on Democrats or Republicans here, but it does seem that we could be doing better in Lansing. The Republicans, I have a note here. It says State Representative Luke Merriman is calling for the removal of the UIA director, and that's going on the other side of the aisle. I get that, okay, but you guys got to figure out a way to work together on some kind of legislation, maybe the loan, maybe just temporarily approving all applications for a period of 2 to 4 weeks, although I know there's no easy solution. That would probably create more fraud, but there's got to be something that can be done to make this better. There must be hundreds of thousands of people around the state who it's been since early March.
Yes, it has been. And just so you know, a lot of it isn't in our hands. It's federal rules that we can't just change or shortcut through. So also reach out to your federal representatives and senators and let them know that it's an issue, because a lot of the things that are frustrating to us aren't within our control. They're federal rules. So, and also, as you were saying, the computer program was built to make it difficult to be approved for unemployment. And we need to fix that too.
All right. Representative Kennedy, I feel better just talking to you. Thank you for giving us some time, and you're a good person. I know you're doing your very best. Real quickly, before we say so long, you are on the Learn Advisory Council. What is that? And I'm sure it has something to do with schools, as you are a former principal in Walled Lake. Could you tell us what that's about?
Sure. So Return to Learn Advisory Council is a group of stakeholders and experts in both the field of the Department of Health as well as education, who are creating guidelines for how we can go back to school safely in the fall. We had our first meeting on Friday, and I can't tell you how impressed I am with the group, because we really do have a broad group of stakeholders, as well as the folks leading the work come from an organization that were in the person who runs the organization was responsible for all school operations in the state of New York. And we are working alongside about 7 other states on the same issue, which is how do we most safely and appropriately get kids back in school in the fall. So we're having our next meeting tomorrow, and our mandate is to have some broad guidelines by June 30th so schools and parents can know in general how they're moving forward. And then specifically, we'll be dealing with special populations separately, like special education students and so forth, which come with a whole nother set of needs and challenges. So, stay tuned. I'm really excited about the work we're doing. We've got all the right people in the room, and I think that we're going to be able to create some guidelines that are both clear but flexible as school districts look to see what's going to work best for them.
That's good to hear that an educator such as yourself is part of that group. We wish you the best of luck. Some of the schools aren't really waiting, and ultimately a lot of this is up to your local school district as to how they're going to proceed. I know West Bloomfield in particular, they were one of the first districts in the state to lay out a plan, and less student population in the buildings, some more e-learning as they've been doing, but good for everyone to weigh in on it. And we look forward to hearing what you're putting together, and feel free to reach out to us as you come up with a plan. Okay?
Will do.
All right. She is State Representative Cheryl Kennedy. Thank you so much. Good to talk to you today. And we will keep in touch on this unemployment issue, and we appreciate your time.
Please do.
Okay.
Please
very
do.
good. Very good. Thank you. All right.
Bye-bye.
Well, Tyler, there you go. Nice person. She's doing what she can, but just doesn't seem like there's a lot of action going on in Lansing. But we're going to keep pursuing it. We're trying to get a hold of the director of the unemployment agency or their number one representative for the media and get some feedback maybe in the next couple of days. Meanwhile, an awful lot going on here in West Bloomfield. We're going to take a break. We'll be back in a couple of minutes, not just West Bloomfield, but all across, forgive me, our coverage area, which includes most of Oakland County. We're going to check in with our good friend John Fitzgerald, the chief of police in Kegel Harbor. On top of everything else, it was a pretty stormy day here yesterday. A lot of people still are without power today. We'll get an update for the chief on that and everything coronavirus when we return. You're listening to and watching the Megacast on 89.3 Lakes FM, 88.1 The Biff, and 89.5 Avondale Community Radio, along with Civic Center TV, Birmingham Area Television, and also CivicCenterTV.com. We will be right back.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft.
And I'm Dave Scott. Thank you for joining us all across the region today. On this stormy day, at least the follow-up of a stormy day, Tyler, did you see a lot of power lines and trees down on your drive home from the studios?
I didn't see a whole lot of issues. No, I actually, out this way, it was pretty calm. We had some high winds initially around 5 o'clock, 5:30 yesterday, but the rain came down. It was torrential downpour for a few minutes. We had a couple little power flashes, but other than that, it was a pretty calm afternoon for us here, considering the circumstances.
Hundreds of thousands of people did lose their power, and last check, there was still six-figure numbers with power outages. Maybe at some point we'll bring up the DTE map and see how we're doing right here in Oakland County. But I know a lot of people are without power, and if you are today, we thank you for tuning in on your little radio and staying with us, and we'll get through all this together. Just another thing to add into the mix. Joining us now is the Chief of Police in Keego Harbor, John Fitzgerald. Chief Fitzgerald, thank you very much for joining us today.
Morning, Dave. Morning, Tyler.
Oh, good to have you. Let's talk about the storm real quick. Much damage in Keego last night in your surrounding area?
I haven't had a lot of reports of it to me. Been busy prepping for another situation, so not a lot has come in about the any storm damage for us.
All right. Thank you for the update. We appreciate it. So we've seen some protests in communities, clearly, in our backyard. Have you had anything going on in your community or anything that you're aware of that might be coming up?
Yes, we have a protest coming to Keego Harbor tomorrow, Friday. It's going to start about 4 o'clock in the afternoon. We've been in contact with the organizers, met with them. Looks like it's hopefully going to be like most of the rest of the ones we've had in the area, a peaceful protest, people exercising their First Amendment rights to get their message out there. They're going to start at the Keego Harbor City Hall. The plan is to walk up to Orchard Lake Road, go up Orchard Lake Road into Sylvan Lake, cross over at the traffic light, walk all the way back down to Commerce Road in Orchard Lake, and then cross over and come back to the Civic Center. It's supposed to stay on the sidewalk so traffic can flow. That's going to be rush hour when that happens. The organizers have captains for their walkers so they keep them on the sidewalk. And we're looking forward to a peaceful protest of people exercising their rights.
Yeah, I'm sure it will be Friday afternoon in your backyard, right along those roads, people heading home after work and people heading out to some of the area restaurants now and maybe heading out to the lakes for a little early weekend enjoyment. It's always a busy time, so you take all that and you get all those people right together at that very busy time of day, and I'm sure you're going to have your hands full. Have you talked to other police departments around the area that have already managed a protest in their community, just for any input?
Yeah, we have. We've been getting information how they went and how they handled the things, and we're trying to mirror what has worked at the other places. We're working in conjunction with Sylvan Lake, Orchard Lake, West Bloomfield. We're all trying to work on this together. A big note to everybody that might be thinking about coming down to the protest here. Keego Harbor has very limited parking. Carpool if you come down here. There's no parking on the streets at any time. And that's just the way the city ordinance has been. There's no parking on the street. And think about the businesses. A lot of our restaurants, this is going to be their first Friday night opening in months. They're trying to come back from a rough spot with not having their restaurants running. It's their first Friday night opening. They might not appreciate non-customers taking up the parking spots. The organizers have said they will be out. They've talked to different businesses where you can park, and they're going to be posting signs at those businesses that have allowed parking. But like I said, there's limited parking. So if you're coming, please carpool and park in a legal parking spot. I don't want you looking over from the protest and seeing your car being towed away by a tow truck, because most of the private lots around here and the businesses have towing, and they can have your car towed immediately out of their lot if you're not a customer.
All right. Well, and I know you're doing this in a friendly way to help people come to your community in a safe way and not leave with a bad result. I know you're not in any way discouraging people from coming to Keego Harbor because we've had many conversations, and that's just not the way Keego Harbor is. I just want to emphasize that to people. Am I safe in saying what I just said?
Oh, absolutely. And monitoring some of the stuff that's on social media, I hear Kego Harbor residents going, good for you guys. The younger generation is going to make changes happen. We want to be at the march. And then we got a lot of people say, I'd like to be at the protest, but I'm too old to do that. I'm too old to walk. But they're trying to support them. Give them that mental support and so it looks like a large percentage are behind a peaceful protest by everybody, and so are we, because that's what this country's made up of is peaceful protest for change, and we're behind what they need to do.
It's been so inspiring, Chief Fitzgerald, to go to many of these other protests. And, the folks in the Troy Police Department got everybody off to a good start. It was one of the first suburban protests in Metro Detroit, handled well. At that point, there was a lot of negativity surrounding many of these protests, and the Troy Police Department did an amazing job. And then from there on, many of these other protests have gone really, really well. But as you indicated a moment or two ago, predominantly young people attending, and it's been remarkable to me. They've all handled themselves so well, expressing their concerns, making their point, but doing it in a really positive way. And I only hope for and expect we'll see the same thing on Friday in Kego.
Well, I think that's how you get your message out the best, is you present it in a positive manner, and people open their minds up to listen to you. If you present a negative manner, if you present a violent manner, people on the other side are going to close their minds right away and say, that's not a good message and we want nothing to do with it. You bring a positive message, present it in a peaceful way, and you change minds that way.
You run a very small department. I'm sure the last thing that you, trying to manage your department and your budget, want to see is budgets reduced for police departments in Oakland County. But I know there's a lot of talk about finding a new way to police. Do you think there can be some changes as a result of what's happened here, even in departments like yours where there's been no history of problems? Are there things that we can do better?
I'm sure there's always something we can do better, and we're looking for ideas that can come up. Is there a way we can get domestic violence people into a social work system more than a criminal justice system? I mean, that's for problems that before they get physically violent. Once you get physically violent, that's a criminal problem, and it's not a safe situation for somebody that's not probably a police officer to walk into. But is there a way we can get social workers into that kind of thing? It's something to be looking at. And there's a need for funding for a lot of different things in society. I'm still going to say we need the funding for law enforcement, though, because it's always going to be out there. Do we just stop enforcing laws and turn our head at speeding traffic down Orchard Lake Road? We have citizens complaining about that all the time. That's a minor crime, and people think we're oppressing people by enforcing that. We're not. It's the request of the citizens to keep their community safe, and that's why we're here. So we still need our funding. We just have to look for some alternate things and some alternate funding to bring in other solutions.
Your police officers, along with police officers in every community in our country, have to deal with so much, though. Many things that go well beyond just, taking care of criminal matters. It seems that when anybody is having any societal problem, they'll dial 911, and the first person to show up is somebody in blue with a badge. And that's got to be a challenge for your department and every department around the country.
It is. We get sent to, because you dial 911 and we show up, and we get sent to many things that really are not criminal justice matters. They're not police matters. We do our best, and we use ongoing training. An officer doesn't get trained in the academy and then stop having training. We try and find the best, latest training for de-escalation, for dealing with citizens, for there's numerous things out there, and we try to get our guys out there to keep trained. And we realize when we go into certain situations that this is not something as a law enforcement officer we can solve here. Let's try and refer them off in the right direction. Let's get them to understand that, no, we can't do something. It's not that we don't want to do something. It's no, we legally can't do something, or there's nothing for us to do there. So, and we're working on making sure our officers are trained to know the difference. And I think they are. We have a great bunch of guys here that I'm proud to work with at Kego.
He is the chief of police in Kego Harbor, John Fitzgerald, joining us. So, as you mentioned, the restaurants are opening again, and the clubs are opening again. The bars, if you will, are opening again. Many establishments now are considering expanding the area they have outside. and a number of establishments in your jurisdiction already have some outdoor seating. Do you think as we give these restaurants an opportunity to social distance that we can expand that a little bit as they're working on in Lansing and many of our municipalities and do so in a safe way that won't create any harm to the community?
Our city council's addressing that issue right now. I think it's coming up at our next city council meeting. The police department is definitely not opposed to it. We just want to make sure. I mean, we want to see the restaurants get back. We all love going to them too, and we want to see them succeed. We got some great restaurants in town, and if it takes expanding their outdoor patios to where they can do it safely, we're all for it. The only thing we want to worry about is not letting people take a drink out to their car and walk away. You know, it's a liquor law they can't violate anyhow. So we got to be careful with that. But expanding it so they can succeed, we're all for it.
Yeah, as long as we don't take up 2 lanes of Orchard Lake Road for seating in front of the lodge, I think we'll be we'll probably be just fine. All right, Chief, anything else you want to add before we say so long?
Hey, I look forward to seeing a lot of people tomorrow at the protest. I'm gonna be out there and try to meet some people. I've met the organizers already. They seem like a great bunch of they're college students. Had meetings and talked with them, and I look forward to seeing people and hearing their points of view out there. We're not totally closed-minded in this whole thing. We're all in this together, and we want to come through peaceful in this.
Well, and it's been remarkable to see what's been happening and the depth of commitment from the organizers of these protests, and then the people to show up. You know, I've been around the state of Michigan a little bit over the past month, and I go to northern Michigan on the weekends, and even in these small communities in northern Michigan, there have been significant protests. So every community is touched by this, and kudos to those people that are out exercising their right to free speech and doing it in a beautiful way. And I think it's created a lot of really nice opportunities for law enforcement to be able to have some direct dialogue with people at the same time. So it's there's been an awful lot of good. There's been some challenges, but an awful lot of good. We look to more of that good happening on Friday in Kego, and glad to hear you're going to be out mingling with the folks on Friday.
I will be. I'll be out there, Dave.
All right. Thank you, Chief. Appreciate your time today.
All right. Have a great weekend, Dave.
Very good. He is the chief of the Kego Harbor Police Department, John Fitzgerald, and we appreciate him being with us today. Tyler, I'm really impressed with the continuing effort that is going on to keep this issue alive. A lot of times you'll have a matter come up, as we've had come up here, and, it'll peak, and then a week later, something else comes up and people's memory is short and they move on and get back to their busy life. That has definitely not been the case here.
I would agree. I think that for the first time in a while that this issue is being taken seriously. And it's being taken seriously not only by the organizers of the movement, but also by law enforcement and other people that are involved in making these changes so that we can actually move the needle forward and make some necessary societal changes based on what we learn in all of this.
All right, well, let's take a break. We've got a little bit of time. Our Secretary of State from the state of Michigan, Jocelyn Benson, is going to be checking in a little later on in the program. We're also going to hear from Eric Wallace, the president of Henry Ford Hospital, West Bloomfield. We'll talk about the latest on the coronavirus front with him. And then Jeff Cranston joins us, the director of communications for the Michigan Department of Transportation. As we throw money at so many different things, our terrible problems with potholes going to be left by the wayside? We'll try to get some update on that coming up. We'll be back in a minute. This is the Megacast on 89.3 WBLD Lakes FM, 88.1 The Biff, and 89.5 Avondale Community Radio, Birmingham Area Municipal Access, and Civic Center TV. And a big thanks to Debbie Binder, West Bloomfield Township Clerk, for including the show on their Facebook page today. Tyler and I will be right back.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft.
And I'm Dave Scott. Thank you very much for tuning into the Megacast today. Tyler, this little old program began as a broadcast. You and I were just sitting around talking one day after meeting with some of our local elected officials who said, we have a storm coming in our direction. And we talked about doing everything we could to get information out to the community on a daily basis. We started that in the West Bloomfield area. Now it's expanded across most of Oakland County, and we are privileged and honored to be able to be with you each and every day. Tyler, this is day 62 of the Megacast. Do I have the math right?
I believe so. I believe it is. Yes, day 62. Monday was 59, so that would make this 62.
All right, very good.
61.
I had to get my finger. I had to get on my fingers out to count that. But so we are glad to be here. The mission of the show is to get a very local perspective on what is going on right now. It started out exclusively Megacast, but as the issues have just piled on top of each other lately, things have gotten a little bit more complicated. So we understand that. Our own Erica Jones is in the field. We'll get to her in a couple of minutes and check in with her and see what's going on as retail and restaurants continue to open up in and around our area. We're going to talk to Eric Wallace, the president of Henry Ford Hospital, West Bloomfield, and we are getting new visitation rules, Tyler. You can't go into a nursing home, but you can go in and visit someone who is ailing at a hospital. So that's nice. It's been awful difficult. I can't imagine a loved one getting really sick and not being able to be there holding their hand or at least letting them know that we care about them.
It's definitely got to be a tough situation, and I feel for the people who have been in that position over these last 3 months, whether things got better and especially if things got worse. It's a horrible situation, and hopefully, much like the hospitals are changing their visitation rules and people are able to come back and visit their loved ones, hopefully we'll see that soon with nursing homes as well.
So what's going on with the World Health Organization lately? They seem to be flipping back and forth on whether or not asymptomatic people can actually transmit COVID-19. Have you been keeping an eye on that at all?
I have, and it does seem like they're bouncing back and forth about that, about whether or not you're able to pick it up on surfaces, and there's been a lot of competing information coming from health experts, especially in the last week or so, and definitely from the World Health Organization, as they seem to be really struggling to understand the asymptomatic carriers of COVID-19.
So let's read from an article. We have a minute or two at clickondetroit.com, and I would ask Jeff, the producer of the show, to link to this article on civiccentertv.com/coronavirus if he has not done so already. Reading from the article in a press briefing on Monday, the World Health Organization, who made, not who, but that's almost like a who's on first thing, isn't it, Tyler?
It is a little bit like that.
I got myself trapped. In a press briefing Monday, the World Health Organization made a confusing statement that appeared to contradict the Center for Disease Control and Prevention. In the statement, the WHO noted it appeared to be rare that an asymptomatic person would transmit the virus. It seems like a big difference in the guidance from the CDC. On Tuesday, the World Health Organization walked that statement back, issuing a clarification that better defines what they are referring to. And, you know, the WHO has been a target of the President of the United States, and certainly under a lot of criticism for the way they handled this thing right out of the box. President has said he doesn't even want to keep funding the World Health Organization. I think we have been getting better information, whether you want to get political or not, with that whole conversation. Seems to be getting pretty good information from the Center for Disease Control and our local health organizations, Tyler, who we have links to both of them on our website, and I advise people to go there. Now, this is an evolving situation. We're going to get new information, but no one has been saying that asymptomatic people can't transmit the virus.
No one's been saying that at all. It's always been that asymptomatic people may actually be more dangerous because we didn't know if they could transmit it or not, and they're the ones that we don't see having the virus.
Okay, and that brings us back to the next point of the day, and that is we are seeing a little bit of a spike of COVID-19 not in Michigan, but in other states, some of the first states that were the very first to loosen up their stay-at-home orders, and now we're seeing some spikes. Any thoughts, my friend?
It doesn't surprise me. I think we're bound to see some spikes as things reopen because you are going to have people that, no matter what the suggestions are not going to follow the rules. They're not going to wear their masks, and they maybe aren't going to be as cognizant of social distancing measures. So that doesn't surprise me a lot. And having more people out and about, more stores open, there's more of a chance of exposure no matter how safe people are being or no matter what regulations are being put in place. So it doesn't surprise me, but maybe these states also opened up a little too quick. Time will tell.
Well, we don't know that, and
right.
And you know, it could just be that people need a reminder. I'm even guilty of it myself to some small degree. It has been a little bit of an issue as things open up, and now we can do this, and now we can do that, and we can go to the restaurants, and we can get involved in a lot of other things that it's only natural people might be a little bit less careful about wearing their masks when they're out and about.
I would agree.
Yeah, so let's go see what it's like in the field right now. I don't know if she's ready for us or not, but if Erica can hear us, our own Erica Jones is standing by, and she is out in a retail establishment somewhere. Let's check in with Erica. Erica, thank you for joining us today. Where are you, and what are you running into?
Hey, Dave. I am at Bed Bath & Beyond in Novi. They actually just opened on Tuesday, so they didn't open immediately as soon as restrictions in Michigan were lifted. And I'm actually currently waiting. I have 2 employees sent out right now for me, seeing if they're allowed to talk to me. I think because this is a larger business, they need permission, but it looks like there are a couple of people coming in my direction right now. But I definitely think this is the type of place that it's been very hard for people to go without, just with so many home goods that are necessities that people use every day. I guess it wasn't deemed as essential, but it's definitely stuff people need.
So how are people doing, Erica? We can come back to you in a minute when those guests are available. If they're not available now.
Yeah, I actually have someone right now.
Okay, very good. Erica Jones at Bed Bath & Beyond. Go ahead.
Hi. So I'm live on Civic Center TV. Can you tell me how your reopening has been? Oh, you don't? Okay. Okay, I totally understand. Thank you so much. Okay, yeah, thank you so much. Sorry about that. So we're going to see if we can get a customer to talk to us, but
All right.
it seems pretty good. Things are going well. Hi, how are you?
Er-
Good.
Erica, while you're getting, I'll give you a minute to see if there's
Yeah.
somebody that wants to talk to you. Tyler, we continue to see this here that people are wearing their masks. I saw the guy from the store. He's got his mask on. Every time we go out to Erica in the field, it seems that people are doing a pretty good job masking up.
I would agree. It looks for the most part like people are doing their part, and I think by and large people are wearing their masks. They are being cognizant of social distancing. There's always going to be those outliers, but I think if the vast majority of people are doing their part, then we're going to see positive outcomes come from all this.
Now, here's the other thing that Erica can report on today. And Erica, don't worry if you can't get to somebody. It's just fine because you can tell us the story just as well yourself. But Tyler, here's the story that it hit my desk today. Starbucks has taken a $3 billion revenue hit due to the pandemic. And they say they're doing okay, but a $3 billion hit. And, you know, while a lot of things are opening, Erica, you can help us here by showing us around the store. While a lot of things are opening, we aren't seeing a lot of customers. Erica, I know it's, just before 11 o'clock in the morning, but is there anyone in Bed Bath & Beyond?
There definitely are some people. I wouldn't say a lot. Maybe every 5 aisles, there's one person. So definitely not a lot, but some. And like I said, they just opened for customers to be able to come into the store on Tuesday. So I think it's more so now just getting the word out that they are open. People might not know, but this is definitely a place that people will be coming. And I think there are some items that are sold here that are such important household items. Actually, so soda streams that make carbonated water, very popular amongst a lot of people. I know they were having shortages of those. My mom was out looking for one of those the other day. So items like that people aren't so much essential, but people have been really struggling without for the past 3 months. Now they're all running in to get them immediately, and then they're having shortages of those. So that's definitely been hard.
All right. Well, I appreciate it. It does look quiet, but Tyler, if you went into Bed Bath & Beyond any day at 11 o'clock in the morning when most people are at work, I'm sure it's not going to be that busy. Erica, thank you very much for your update from the field. Good to see what's going on. Always good to check in with you. And if you want to maybe head somewhere else before the show's over, we'll try to check in with you again. Which Bed Bath & Beyond are you in, by the way?
I am in Novi, right near 12 Oaks.
Okay. And is when you went in there, is 12 Oaks seem to be much activity around the mall today?
You know what? I didn't go in the parking lot. I'm going to head over there right now because I got the chance to stop by Somerset last night myself. So it'll be interesting to see if 12 Oaks has more things opening up since the last time we checked it out there.
So before you leave, tell us about going to Somerset. Was it busy?
Not at all. And a lot of stuff is still closed. There were definitely more things open than there were when I went to 12 Oaks a couple weeks ago, because as we saw, virtually nothing was open there. The few stores that were open at Somerset had lines out the door because people needed to practice social distancing. So they had very limited capacities. But other than those few stores, there really was not many people walking around. I've never seen Somerset so dead, but definitely more stores were opening up. A lot of furniture stores were open. And I just think, for me, I just wanted the opportunity to be able to go to the mall because it's been so long, and that was really nice. So people who were there were excited for sure.
Well, no, I get it. And listen, I of the three of us that are on the show, myself, Tyler, and you, my guess is that you probably shop a little bit more than Tyler and I do. So,
Maybe.
if it's the kind of thing that you like to do, I mean, I'm just as happy not going to the mall, only I go when I have to.
Right.
But, for you, this is a really important part of your life. You like just going to the mall, right? So it must be hard. Yeah.
It's very important, and it is hard. And that's why yesterday my mom and I were just like, you know what? We have nothing else to do. Let's just go see what's going on. We didn't know. For all we knew, nothing was open. I would say if I had to put a number on it, maybe 20% of stores were open, maybe 25. But as I was talking to workers from different stores, it definitely seems like a lot more stores will be opening. Also, the mall hours overall are limited. They're open from 11 to 7 p.m. instead of their normal, I believe it's 10 to 9 p.m., but different stores have their own hours. So although the mall is open till 7, some stores are only open till 5 or 6. It just depends. And I think that's more something with their headquarters and how they choose to handle the situation with reopenings.
All right. Well, there's no more real aggressor supporting than what Erica Jones is doing for us in the field right now. And it suits me just fine. It's excellent job, Erica. I appreciate it. Real quickly, before you say so long, can you just flip your camera around and then just tell us what you see? I just want to get some kind of an idea of how busy the parking lot is there and what level of activity you see. Just describe what you're seeing.
Yeah, I mean, there definitely are a good amount of cars in the parking lot, but not as many people walking around. I'd say there's only 2 people out right now, but there are lots of cars, and I think that's even more so. The area I'm in right now has lots of other stores. There's a Marshall's over there, Five Below. There's a furniture store right next to here. So there's definitely a lot of other places in this parking lot that people are now shopping again at.
All right. Erica Jones, thank you very much. I appreciate you checking in.
Yeah, I'll check in again soon. Thanks, Dave.
All
Back to you.
Our Erica Jones in the field. Tyler, there you go. To me, it kind of looks slow out there. I mean, to be honest.
It does. It looks a little slow to me, too. And some of that's going to be that the stores, like Erica had said, in the case with Novi's Bed Bath & Beyond, they're waiting to reopen and getting their stuff in order, their affairs in order, retraining people and making sure their safety standards are at 100% before they return to normal operations. And maybe it's the customers are apprehensive of going back right away, too, and the fact that it's also 11 o'clock in the morning.
Could be any one of those things, or maybe all of the above. We're going to take a break in a minute. Before we do, one more story, and this, again, another one that comes from Click on Detroit. The 46th annual Jobby Nooner Boat Party is going to happen amid the coronavirus pandemic. Boating, bikinis, and debauchery will not be held at bay, Tyler Keefe, just by a little thing like COVID-19. Lake St. Clair's famous, or infamous, if you will, annual Jobby Nooner is expected to carry on as usual this June, according to Click on Detroit. Now, are you from, of course, a respectable broadcaster such as yourself has never attended this event, right?
I have not. I have not attended this event, no.
All right. Well, essentially, it's a bunch of people heading out on their boats and all rafting together and having a really good time on a summer Friday afternoon in June. I don't know exactly the date, but they say they are going to do it. People are going to try to keep their social distancing, and then it could very well happen. So this is an unsanctioned event, so I don't think there's anybody to really cancel it or try to announce that it's going to be rescheduled. But yeah, according to Click on Detroit, it is going to happen.
And I just clicked on a link from that article to the Jobby Cruise website, the people that organize this event, and they don't have a date on there either, other than just saying that it is going to happen. The short answer is yes, this is going to happen this year.
And they do have some tips if you are a boater and you are going to go. There are some tips in there as to the things you should do. And, Tyler, no matter what you're going to, what you're doing, who you're interacting with, if you're going to your office now, be the person that sets the example. Wear the mask, wash your hands, keep your social distancing, remind other people around you that the coronavirus is still active. Do the things that we were talking about when we started the show 62 days ago, and then things are going to be able to get better. Things will continue to open up. But if we screw this up, then we're only going to have ourselves to blame. And there certainly can be environmental factors why the coronavirus is less potent and we see less transmission of COVID-19 in the summer than what we might see in the fall. But, a lot of it is in our hands and our control. So do what you can to stop the spread. We're going to take a break. We'll be back in a couple of moments. This is the Megacast. Dave Scott, Tyler Keefe on 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills, and 89.5 WAHS Auburn Hills, our great radio stations. And thank you very much for watching on Civic Center TV, Birmingham Area Municipal Access, and all our other video outlets. We'll be back in a moment.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hi, I'm Dr. Jonae Caldoon. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe.
And I'm Dave Scott. Thank you very much for joining us across Oakland County on our great radio stations, on Birmingham Area Municipal Television, on Civic Center TV. You can watch both those on Channel 15. If you are a Comcast subscriber in those areas, tune in on Channel 99 anywhere around the area on AT&T cable, and you can, of course, watch on CivicCenterTV.com. Huge thanks to the Greater West Bloomfield Cable Communications Commission and all of our television and radio outlets for making their programming available to us so we can talk to you about the issues. So, Tyler, you know what's so complicated right now is how many things we have going on all at the same time right here in the state of Michigan. It's crazy as to how much we're trying to deal with right now. So, you know, I mean, let's start. COVID-19, the crisis, the deaths that we've seen, the tragedy it's caused, the disruption that it's caused to our economy. And it's been a lifestyle changing event, right? So you take that, yes, and then you add, the news of the last week and the civil unrest in our country and the protests in Michigan. You take a look at the dams and the problems we've had up in Midland with flooding, and then just a day of storms yesterday makes things complicated with so many people out of power, and then our kids not going to school and likely school disrupted to some degree in the fall. The cancellation of Major League Sports, which hopefully is going to be coming back, the disruption to our jobs and livelihood and our summer tourism season here in Michigan. And the list goes on and on. And this hour, we're going to take an opportunity to talk about some of the impact of the coronavirus and in some of these different areas. And first of all, talking about the dams. You know, we've been concerned about the flooding up in Midland, but if we should have a similar event here in southeastern Michigan, you know, we could find ourselves in a similar situation. There is a report that I'm looking at that says there are 6 dams in southeastern Michigan that are considered high hazard potential dams. Article about that, and click on Detroit today if you want to go take a look at it.
It's an interesting article. We probably should take a look at it. This is a story that continues to develop and continues to be a huge issue, particularly in mid-Michigan. But it's like the governor said in the initial wake of that disaster. It's a problem we have problems similar to that with other points of key infrastructure throughout the state. So it's a problem that needs to be addressed or could continue to grow as time goes on.
And state government, local government, federal government, trying to deal with the problems they have. You trying to deal with the problems you have at your business. Now, by the way, I'm an eternal optimist. I'm not saying all this to be pessimistic. I'm just trying to report what I'm seeing. It's a challenge solving the little problems that we have here at the radio show and my other business. Local municipalities trying to deal with making sure this next election is successful and we don't run into the problems that they've been running into in Georgia. dealing with this unemployment issue that we've been talking about for the past several days, just trying to get people, 2 million of them, their unemployment checks. That would be enough of a crisis, Tyler, in and of itself, forgetting everything else that's going on. Not easy to solve.
Yeah. In the regular news cycle, that would be the number one issue right now.
And then our next guest, who we're going to talk to in a couple of minutes, and that is our Secretary of State, Jocelyn Benson. She doesn't have it easy either, because those offices have all been closed. There's a severe backlog of things they need to get done. They've opened their offices now to appointment, and we'll get a chance to ask her in a couple of minutes. But I went online. I can't get an appointment for a couple of months. So it's good. Maybe that's old information. We'll ask her when we talk to her in a few. But, these things are not easy to solve. It's just we have our hands full. So we're talking to the people that are the decision makers and the major influencers, and trying to get some idea of the challenges that we and they are facing. And, the simple thing is say, that our Secretary of State, she's not doing her job. We should be able to walk right in the Secretary of State office and get done what we have to get done. But that doesn't really give you an appreciation for what she is really having to deal with. And we're also going to talk to the Michigan Department of Transportation. No elected official in the past 25 years has been able to fix the road problems, right? But they don't go away. And how are they going to deal with that? So we'll talk to the Michigan Department of Transportation and see if fixing the damn roads is going to be even harder than it would have been. And we know the answer to that because there's no way they're going to have the money that they anticipated. We weren't driving our cars for, 2 months almost? And
most people, yeah.
Right. And just think of all the gas tax revenue that would be going to support roads that isn't there, let alone the additional funding that we would hope would be available to get things fixed up. So, listen, we're going to get through all this, but it's a handful, and it doesn't do any good just sit back and criticize, but it is a handful.
It absolutely is, and we have them, and it's like you said, these are mounting issues. These issues alone are complicated and are tough to deal with and are tough to solve, but take into account what got us, what was the initial issue in all this last 3-4 months, COVID-19 being what it was, it makes all of these issues that much more difficult to navigate.
All right. Our Erica Jones is at an area restaurant. Erica, you ready? Give me a thumbs up if you're ready for us. You got a guess and you're all ready? I don't know. Okay, yeah, she says she'll be ready in a minute. We'll give Erica another minute, a minute or two, and we'll get to her. And again, we're going to talk to our Michigan Department of Transportation, the Director of Communications, Jeff Cranston, in a couple of minutes, along with Eric Wallace. He checks in again from Henry Ford Hospital, West Bloomfield, the President, and our Secretary of State, Jocelyn Benson, will be checking in via phone in just a couple of minutes. While we're waiting for all that, let's head back out onto the streets with our own Erica Jones. Erica, your mic is muted. You're going to need to unmute. There you go. Hi, Erica. What's going? Where are you now?
I'm at Sedona Tap House at 12 Oaks, and I'm waiting for our good friend Marty Nolenberg. Told us we could talk to someone I believe is the manager. I'm not completely sure. So I came in, and I'm now waiting for him to come and talk with me.
All right. Well, let us know if you get a hold of anybody. Just wave at the camera. We'll see you, and we'll get you connected. Is it crowded in there, okay, Erica? Stay with us. Is it crowded in there?
No, it's not crowded at all. They just opened at 11 though, actually, and it is 11:09. So is he going to be available to talk soon or?
Erica Jones, we're going to come back to you in just a couple of minutes. We'll be back with you in a moment. Tyler, let's take a break, and we'll be back, and we will check in. This is the Megacast. Thanks for tuning in.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet Wear facial coverings when you leave your home and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft.
And I'm Dave Scott. Thank you for joining us. Tyler in our West Bloomfield studios, and I am in our Troy studios. Erica Jones is out in Novi right now, and we're all over the place. And Erica, you are at what restaurant? Where are you?
Hi, Dave. I'm at Sedona Tap House at 12 Oaks Mall, where they're now open again. Did I lose you there?
We did, but just keep going. It's quite all right. We had a little connectivity issue. We're fine.
Where they're open again at limited capacity. So I'm with one of the owners, JD, who's the partner of our good friend, Marty Nolenberg. So he's going to talk to us a little bit about how their opening's been. Hi, JD. Thank you for talking with us today. So when did you guys first open?
So we opened Monday, June 8th. I mean, we've been doing curbside most of the time from both locations, but we opened June 8th at the 50% capacity.
All right. So how has it been since you reopened? How's your staff?
It's been great. I mean, it's been a really good positive feedback from the staff and from the guests. You know, we try to make sure we're doing everything to make it as safe as possible, both for the staff and for the customers. We have sanitation stands spread throughout the restaurant. You're never more than like 12 feet from a sanitation stand. So if you do want to touch your eye or you accidentally touch something, you just get up and go over there and sanitation. Lots of single-use items. Our salt and pepper is single-use. We have these right here. I don't know if you get a good picture, but you can just hover your phone over that, and the menu will actually download onto your phone right away.
Oh, wow, that's nice.
So for people that don't want to touch menus, they can do it on their own phone. And the menus we do have, we went to paper, so it's all single-use menus. All of those kind of things. We're temperature checking everyone. All of our, well, not the customers, but all of our employees and any vendor, to deliver beer, deliver food, they're all getting temperature checked and signing a waiver that goes through the screening that was put together by the government.
That's fantastic. So how are you going about blocking off certain tables to make sure social distancing is being maintained?
So we actually went around with the measuring tape, and we actually removed some of our tables and temporarily put them in storage just so it wasn't too cluttered. And then if you go around, you'll see we have signs on our tables that say they're closed for social distancing.
Okay, yeah. And then how have your numbers been the past few days since you've been open? Are you reaching 50% capacity?
At times, for sure. At times we're reaching. I mean, we actually, on Monday, the first day, we actually did have to go on a little wait. We're lucky that we're here in the 12 Oaks Mall. In some places, they have to actually go sit in their cars. But for here, we use Yelp Wait Plus, so we can actually text the customer when their table's ready. So sometimes if it's a small wait, they'll check in, maybe go shop at one of the stores real quick, and then we text them when the table's ready, and then they come back.
Wow, that's great. And did all of your employees come back, or did you have some that weren't willing to come back just yet in the pandemic?
There's been a mixed baggage. I think just like the country as a whole, there's a lot of different how everybody feels about this. Some people feel safer than others. We have some people that want to come back when we're maybe taking care of somebody or trying to get their daycare started up. And then we also had some people that want to come back, but they had traveled outside of the state. And so when they come back in, there has to be a 72-hour period of them being symptom-free. So we have some people that are coming back this weekend that couldn't come back Monday because maybe they traveled last week or something. And then there's all kinds of criteria through the employee screening. So I would say a majority of the staff has came back, and those who haven't, they want to come back. They just want to wait a couple weeks.
All right, good. And are you still doing a lot of curbside the past few days since you've opened up, or has that lessened since people are allowed to come inside the restaurant?
The curbside has dropped off a little bit, but I would still say it's above average of what it used to be. So if our curbside, and that's for both locations, so our curbside sales they're up over last year or where they were before, everything. And so, but they have dropped off a little bit.
Erica, can you ask him if by any chance anyone has come in and ordered a quarantini yet?
Yeah, he can hear you, Dave. So
yeah, I remember when I was next to Marty when you did the last interview. We're working on that recipe. We're going to run that by the PR group.
All right. Well, if you guys come up with a really good idea for a quarantini, I'm coming over next week. So you got maybe, 3-4 days to work something out.
We'll work on that, boss man.
And if I come up with an idea, or any of our listeners or viewers come up with an idea, we'll let you know. Hey, thank you so much, Erica. And your guest, I did not catch his name because I apologize. I don't have it here. But thank you. Congratulations. And good luck. As I know, it can't be easy. It can't be easy running a restaurant with that black mask on your face. But you look good, and keep up the good work. And thank you for being with us.
Thank you. Appreciate it.
All right. Thanks, Dave. Back to you.
All right. Thank you very much, our own Erica Jones at the Sedona Tap House in Novi. They have a location there and in Troy, and we get a little idea how things are going. And with that, we're going to take a break and send it back to Tyler in the studio.
Yes, Dave, we do have Jocelyn Benson on the line with us, our Secretary of State. We'll take a very, very short break and come right back with her. You are watching and listening to the Oakland County Megacast on our family of stations.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft. Dave Scott is with us as well in Troy.
All right, thank you, Tyler. I'm in our Troy studios. Tyler back in West Bloomfield. Joining us via the phone is Michigan Secretary of State Jocelyn Benson. Secretary of State Benson, thank you for being with us today.
Thank you for having me.
This is the craziest radio TV show I've ever done. I mean, I'm on Zoom. We got somebody out at a restaurant in Novi on their iPhone. Tyler's in our studio. We're like it. But that's just the way it's all happened today. We have had to all figure out how to do our jobs in a whole new way. And oh my goodness. And
we are adapting and overcoming.
We are. Listen, I am the poster child for what is a challenge for a lot of people when it comes to licensing, because my birthday, unfortunately, was March 29th.
Oh, and happy belated birthday.
Well, thank you very much. But, I appreciate the executive orders from the governor keeping me out of jail right now. But, boy, I need two things really bad, and we'll get off me and talk about everybody else. But, again, it's good to talk about this. I need a haircut really bad, which we'll take care of next week. And I definitely need a visit to the Secretary of State, because a lot of the things that I do, I have to do in your office because I had a birthday and my dress changed.
Well, you can, I don't know if you've tried it, I don't know the technical issues, but you can change your address online. You can renew your license online and also by mail, and you can also change your address by mail. But for folks who do need to come into our offices for a transaction that has to be done in person, we have reopened by appointment only, and we are going to be increasing the appointments. So we know right now a lot of the appointments are taken, particularly in the Southeast Michigan area. We're actually releasing thousands of appointments slots every morning 24 hours in advance of each day to allow for same-day options as well. So we're working to comply with the governor's social distancing guidelines and avoid crowding in our offices through this appointment option, which has been so far going smoothly and efficiently across the state. But that said, we encourage everyone to check and confirm that they need to come in the office, because about half of the people who come into our offices in the past have not needed to do that in order to get their service done.
All right, so I'm going to go back on the website because I might have been wrong about things that I just assumed I actually needed to physically do in the office. So if I can do it online, great. And thank you so much for that tip too, Secretary of State Benson. So you guys are releasing more appointments every day, because when I first logged on, it looked like I wasn't going to be able to get in for a month or so. But it's really good to hear that there are new appointments. So should we keep logging in every day to see if we can make some progress?
Yeah, check back. And I mean, look, the reality is there's also a backlog right now. We were closed for over 2 months, and so it's not always going to be this hard to get an appointment. This is a very unique moment, and that's another reason why we've extended the deadline to renew until July 31st. But that said, every day there are, as I mentioned, same-day appointments opening up and available, and people can also, we don't encourage this, but in an emergency, you can go to a branch office. There will be someone to greet you at the door who can then also help assist with making a same-day appointment, and then you would come back. And so that's like, in the direst circumstances. But for change of address and for renewals, the vast majority of those can be completed online.
Okay, well, I'm going to get to work on that online this afternoon. I'm just sitting here scratching my head thinking, we've had so many emergencies lately. What could be a real Secretary of State licensing emergency? But I'm sure there are some that come up with people.
Too many people, yes. I mean, people need to drive to get to work, and, we are still in this moment for the next few months where I think there's going to be a lot of leeway around licensing and vehicle plates and all that. So, people do have time, and you can also call, or folks can call if they want, 888-SOS-MISH, M-I-C-H, with specific or unique problems, because we want to be receptive to that. But again, there is a significant backlog for people like yourself who otherwise would have been able to have this done in March, who are now, trying to get things done. And we're going to keep monitoring that to see if, we need to even extend the expiration date even further to make sure, that we're...
So Secretary of State, we've been out of the streets now that we've been able to get back out, reporting in restaurants and retail, as we did just before you came on the air. And we've seen some really creative ways for people to implement their social distancing. There's a restaurant in Sylvan Lake where the proprietor, Vicky, there put these stuffed animals on the tables you cannot sit at and called them COVID monsters. And then it was great. And then we found a Coney Island on Telegraph that actually put shower curtains in front of the booths that couldn't be opened. So we've seen it all, and I imagine you've had to do some creative things in your offices as well to help people with social distancing.
Yes, I mean, we created social distancing guidelines. We require all our staff to do health checks every morning, wear masks and gloves, and we place plexiglass separators at all of our counters. And so, we're all having to adjust and invest in more safety equipment right now. And we actually had our employees come back a full week early before we opened our offices, just to kind of do a deep cleaning and prepare with all these additional protections in place. And then, we also hope and expect the public will wear a mask when they come into our office to, again, protect themselves and our staff.
There's been, and this one gets a little political, and we just hate doing the political thing on the show. So,
me too. I don't like
good.
politics.
So we'll stay out of the mud and just try to share information.
Yes.
So people are duly concerned after watching the news last week and seeing the challenges they have with the election down in Georgia. And then there's been a lot of debate about absentee ballots here in the state of Michigan. We got a really nice public service announcement from our Rochester and West Bloomfield clerks about absentee ballots and how to go out and get them. Do you have anything you want to say about this upcoming election and, any challenges that we may be facing or things that are going okay?
Yeah, I think people can be certain, and this is a time of great uncertainty in so many ways and changing, and as you mentioned, multiple emergencies. For us, we want to give people certainty and clarity around the two things. One, that the elections will happen in August and November. We want everyone to have confidence in that. And two, when they do, you'll be able to either safely vote from home by mail or safely vote in person. We're trying to protect and create safe ways to do both of those things. One of the ways we do that is by ensuring everyone knows of their choices, and particularly their choice to vote from home, which they have a right to do. It's a new right under a law that voters passed themselves in 2018, amendment to our state constitution. So there is a need, and our clerks have been great at educating all voters on how to exercise their choice to vote by mail and vote from home. And a lot of people have been taking that choice because it's an easy, safe way and convenient to conveniently cast your vote. But we also want to assure people that we will be providing a safe in-person option as well, so that we can have choices, and voters can feel if they do want to vote in person, they'll be able to do that.
I assume a well-connected person such as yourself every once in a while has a chance to talk to the governor. Do you two talk at all?
Yeah, regularly. Yep.
So can I just ask you, this is probably the one question I assume no one else in the media has asked, but maybe they have. How's she holding up through all this?
That's a great question. I think this has been challenging. I mean, she's an incredibly strong person, incredibly smart, and very focused. And, this is a time of heightened anxiety and stress for so many. And to stay focused on providing solutions and to kind of, stay above the fray but understand that everyone is, in this, we've got an economic crisis, we've got a health crisis, we've got a political crisis from making sure our democracy can continue safely and securely. So I think she's handled so much with grace and strength, but, I can't imagine. I know her. I've known her for a long time. I know how much she cares about all people of Michigan, truly. And it's just got to be tough when you see people, suffering in this health crisis and in this economic crisis, and trying to do the best you can to improve everyone's lives. But we're up against a significant mountain of challenges.
But she's kind of in a no-win situation to some extent. Really, everyone that is serving right now is. This is a very difficult thing to untangle. There's no textbook to it, right. And there's no way to make everybody happy. I get that. You can pick on some of her decisions, but there's no way to make everybody happy.
That's right, and I think that's, to me, I go back to data. I mean, my background is as an academic and I ran a law school, but I like data to define how we act, because I think data can help inform best practices. I like looking at best practices and trying to replicate things that work and avoid things that don't. So I think there are ways that you can lead right now, and to me, the thing that also underscores everything is that we're at a unique moment of history, and the way that we act, the things that we do, will define how our state and country reacts to future potential pandemics or similar crises. And so we have to be mindful of that and to lead, doing the best we can right now and with an eye towards setting a good precedent for the future as well.
All right, last question, I promise, because we've taken a lot of your time. And this is, again, about her. Do you think she'll be the vice president of the United States? And if so, would she do a good job?
I think she'd do a good job in anything that she did, and I think she's very committed to Michigan. I mean, I don't pretend to know the workings or decisions are being made far above my pay grade, but I know about her. I know she's committed to our state.
Madam Secretary of State, thank you so much for being with us on our show. And let's keep in touch, and I know you got your hands full. Good luck with everything.
I'll come back anytime. Thanks for having me.
Very good. She is our Secretary of State. Jocelyn Benson joining us here in the program. Standing by is the president of Henry Ford Hospital, West Bloomfield, Eric Wallace. We'll get to him in just a couple of moments. This is the Megacast on 89.3 Lakes FM, 88.1 The Biff, and, of course, WAHS 89.5 Avondale Community Radio, our television outlets in Birmingham, West Bloomfield, and beyond. And we will be right back.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft.
I'm Dave Scott. Tyler, you've been washing your hands?
All the time, Dave, nonstop.
You got your mask on?
When I'm not in the radio studio, you know it.
Yeah, I don't have mine on right now, but the second I get off the air, it's just going to get I'm going to mask up. So, do you think the blue side is better, or do you like the white side better? Which one should I go with today?
You know, the white kind of blends in with your shirt, but the blue kind of makes it kind of pops more. I like the blue. I'm a fan of the blue.
Yeah, so we've seen some really creative masks. Bottom line is wear it because, you know, and I'm concerned right now, Tyler. We've seen some spikes in other states, and we're all getting pretty casual and comfortable. Governor seems to be opening up almost everything right now. We've got the salons and the other establishments that have not yet been open. Many of them will be opening up next week, and people are getting a lot more relaxed. And I think now more than any time is the time we really need to be on guard and careful.
I would agree. I think that now more than ever, it's the easiest time for us to get complacent. When the virus was first starting to spread and we didn't have a lot of information on it and it was spreading exponentially, we were at a point where we were very fearful of it, and that kept us mindful. Now that we're coming out of things, we're relaxing a little bit more. It's easy to become complacent, and that's arguably the time when we need to be the most vigilant about our behavior so we can keep ourselves and our neighbors safe.
Yeah, and do be careful. I know hard at work, and certainly not taking the foot off the accelerator at all, is our healthcare community. And joining us now is Eric Wallace, the president of Henry Ford Hospital, West Bloomfield. Thank you for joining us again, Eric. Good to be with you today.
No, actually, Dave, I really appreciate you having me, and I appreciate the reminders to everybody that this thing has not quite gone away yet, but and we need to remain vigilant.
I'm sure that your people, the physicians, the nurses, and everybody else at the hospital, they've been on the front line. They've seen this firsthand, so they probably don't need reminders. But you guys have to, stay at it too, because the disease is still out there. I'm sure that's going through everybody's minds at the hospital. Can you talk about that?
Yeah, no, I think, we feel very blessed that, we've kind of gotten through this whole event to this point. I'm excited to say that, even today here in our hospital, we're in the number of single digits of patients that are in the building that are COVID positive, which is a tremendous, testament to the hard work that everybody's done, the fact that people have been doing social distancing and wearing their masks. But we are very concerned about the potential of, as the state reopens, that another wave of this happens. I think just last evening in the news, they talked about, 9 states across the country where they're seeing their highest numbers ever of COVID now as they've reopened. So we're trying to stay prepared, making sure that we get as close back to normal as we can, but at the same time, again, acknowledging that this hasn't gone away yet, that we've got to be prepared for what's going to come next.
Eric, the deep concerns at the very beginning of this were, A, we didn't really know what we had on our hands. B, we were very concerned that medical practitioners and hospitals would be able to even accommodate the numbers that would be coming at them. Now we know a little bit more about how to treat the disease. People know how to do some prevention of their own. And capacity, at least today, and supplies and testing and PPE, we seem to be in much better shape. So we don't want to see it, but if there is a peak or we see numbers start to creep up here in Michigan, aren't we better able to handle that now than we were in March?
Yeah, no, we are certainly in a better place today. I think, we are blessed here in West Bloomfield to be part of the Henry Ford Health System. And we've seen some of the things that our system has done to prepare for that. And if it comes back in the future, we are now sitting with, significant supplies being prepared. We're trying very hard to have at least a 90-day supply of everything that we would need to treat these patients. You've seen recently, I think, some of the announcements that our health system is entering into agreements with other folks to be able to actually produce personal protective equipment here in the United States. So we're not reliant on a supply chain of things that comes from China or other places around the world. And so I think, we will be much better equipped. As always, the number of beds that we have is the number of beds that we have. And so when we exceed that, it gets a little more challenging. But I think we're going to be in a better place to make sure that we have the supplies and the drugs and things that we need should that second wave come.
Yeah, and hopefully at the point that we get a vaccine, which we hope will happen sooner than later, but could be a while off, that we're able to get enough of that vaccine and get it distributed equally and fairly around the country and manufacture that. But, I feel a lot better because I think at least now anything that is essential and related to COVID-19 is going to get made in the United States. I think we've learned that lesson because it can easily be said that I don't want to get political, but it could easily be said that that they didn't help us in China with the disease, and then they didn't help us either with all the things that we've been counting on them to export here to the United States in a timely way.
Yeah, no, as I said, again, I feel very blessed that our health system's got some amazing people in supply and distribution. And we got shipments of stuff from all around the world and planes flying in from the Middle East and from China and from other places. So we maintained having enough PPE throughout the entire event, but there definitely were some nervous days as we went along.
Eric Wallace, president of Henry Ford West Bloomfield Hospital. So we understand from reading the news accounts that people can now visit people in the hospital. How's that working? Can you talk us through that?
No, absolutely. And I said it's one more step toward a little bit of normalcy. And I think, the last couple of weeks, the governor has removed the restriction that we can't have any visitation. And so what she did was really require of each of our hospitals that we have policies in place that do still restrict visitation, but allow folks to come. So here at our hospital, we have open visitation from 9 a.m. to 9 p.m. All of our patients are allowed to have one visitor at a time. So, if folks have multiple family members that want to come visit, they can kind of trade in and out. Folks should expect that when they come to the hospital, they're going to be screened. So we're going to take their temperature. We're going to ask them if they've had any symptoms in the last 3 days, just to make sure that they're not sick and coming as they come into the organization. We've opened up a lot of our what I would call non-time sensitive testing and office visits for our physicians, et cetera. And so we're allowing folks to come and do those. We are still asking folks not to bring visitors if they're just coming for an x-ray or coming for an office visit. But we've got folks that need help getting around and they need someone to help translate for them. So we do have exceptions that are in place to allow people to have those support folks here with them as well. So like most things, I'd love for it to be completely black and white. We have, I would call them more guidelines and guardrails than they are, kind of black and white, here's how it's going to work. Our goal is to keep everybody safe. At the same time, we know how important it is that people have their family and their loved ones around them when they're trying to recover from an illness.
Eric Wallace is the president of Henry Ford Hospital West Bloomfield. Eric, I didn't brief you on this, so if you don't know anything about it, it's okay. And you say, "Uh-oh, what's Dave going to ask me now?" Very simple. So my friends at Fantasy Lighting just texted me a note just a minute ago, and they said, "You're nodding, good, you know about it." They said they came by late one night a couple of days ago and lit up your hospital. Can you tell us what happened? I missed that. I feel bad. I would have been there had I known the exact date.
No, that's all good. We, earlier this year, we had hospital week at the beginning of May, and that really wasn't a good time to try to have kind of a celebration. We were kind of deep into the thick of things. And so last week, we pulled some things out of the freezer and had a little cookout to celebrate our team members. And that night, we had, around midnight, had a little celebration for our night shift team as well. And the folks at Fantasy Lighting were amazing. They came out and projected some words of encouragement up on the side of the building. And we had a little steak grill out on our patio so everybody could be outside and be socially distant. But just the smiles and the looks on everybody's faces when we had something that was a celebration of our team was a lot of fun to do. We hung out here till 1 o'clock in the morning and and fed a whole lot of people. And like I said, the folks at Fantasy Lighting, people walked outside, they saw that display on the side of the building, and just, a lot of them just smiled, laughed, and we're so grateful to be thanked by the community that way.
Well, just one small expression of thanks. Do the people in your hospital and that are working there every day, do they know how much that they're appreciated by the community? I mean, the outpouring's been amazing, but I know they're all working so hard. Maybe they don't see it all.
I think one of the things I love about this community is people have gone above and beyond to support us, to thank us. We've had, I think the last time I counted, something like 800 donations of either food or stuff or PPE or things that came to this hospital from community members to support our team. And so, I think you're absolutely right. We got a lot of folks who've had their nose down to the grindstone and just trying to make sure that we get through each and every day. But the expressions of gratitude, we've had people that have placed signs in our team member parking lot as folks have come in and people come onto the campus. We just had folks that show up at the front door some days saying, hey, I want to donate, XYZ to your folks or feed one of your departments. And so that has been extremely overwhelming, and we are forever grateful for the support of this community.
Eric, I know the answer, but I just want to take an opportunity to reinforce this with people. If you need some elective surgery or some other elective procedure, or there's any reason why you need to go to either your hospital or any hospital right now, there's no reason why you should be fearful of capturing the COVID-19 virus yourself.
No, you're absolutely right, and we want to continue to stress to folks that we're here. We've got a lot of things figured out with this. We know absolutely how to keep people safe. You're going to come into the building now and you're going to see things will look a little different than if you've been here in the past, because we're going to keep people distant. We've got, hand sanitizer and cleaning schedules and all kinds of things to keep folks safe. I would tell you that, hopefully this gives folks a little comfort. A lot of our non-time sensitive or elective surgeries are already rocking and rolling. So we're seeing a lot of folks come back. We're having a lot of great outcomes for folks. We still are hearing a lot of folks that, have a little bit of concern too. So we've got, I would say to folks, we've got this. We know how to keep everybody safe. And if you need care, we're here. And we can do it for you and have it not only be safe for you, but have it be a great experience too.
Eric Wallace, thank you very much for joining us. Good to have you with us. Glad things are going well at Henry Ford Hospital, West Bloomfield, and we wish you the best of luck with everything. And let's keep in touch.
All right. Thanks, Dave.
All right. He is our one of our top executives from our area hospitals here. We appreciate him coming on the show with us on a regular basis, the president of Henry Ford Hospital, West Bloomfield. Joining us in a moment is the Director of Communications of the Michigan Department of Transportation, Jeff Cranston. We'll check in with him. Got to be tough to keep our roads maintained with a dwindling budget. We'll get the latest from him in a moment. You are listening to and watching the Megacast.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com www.civiccentertv.com/health or call 1-800-848-5533.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft.
And I'm Dave Scott. Thank you for joining us across Oakland County on our 3 great radio stations, 89.3 Lakes FM, 88.1 The Biff, and 89.5 Avondale Community Radio. We're also on a number of community television outlets, Civic Center TV in West Bloomfield and the surrounding area, Birmingham Area Municipal Television. Good to have you there. You can find us on Channel 15 across a big chunk of Oakland County on Comcast, and Channel 99 on AT&T, and then you can do what many people do each and every day, and that is go to civiccentertv.com and watch us on our live stream, and then we have every single story, every interview is archived on the site for you to check in. The social media numbers have been amazing. We appreciate all of you tuning in and checking in on our website each and every day. Well, our governor got elected with the slogan, "Fix the damn roads." And now she's really got her hands full, because not only she had to fix the damn roads, now we got to fix the damn dams here in the state of Michigan. And we have like little money and then about 50 other things to fix: unemployment, education, local municipalities, on and on and on. Jeff Cranston joins us from the Michigan Department of Transportation. Jeff, that along with the reduced revenue that's been coming in to support our roads must have you guys concerned at MDOT.
Well, yeah, I mean, big picture, Dave, the way you set that up is exactly right. There are competing priorities for, what's not enough money. The good news for transportation is it has a dedicated revenue stream, and in good times doesn't have to compete with those other priorities for general fund money. The bad news is that dedicated revenue stream took a significant hit as people stayed home for the past 3 months. Most of our revenue comes from fuel taxes and or registrations on cars. People aren't buying cars. People aren't driving as much. In fact, traffic was down, probably 60% on average across the state during late March, April, most of May. It's creeping back now, but it's going to be a while before it gets back to where it was. So, yeah, that's made a significant dent in transportation revenue.
All right, so you already had an enormous challenge trying to keep Michigan's roads in good shape, and now it becomes even more. And yeah, I didn't see anybody on the road. So the 60% number, that sounds conservative to me, but you're the guy with the numbers and the information. So
well, that's on average. So right. Yeah, in Metro Detroit and some of your roads, it might have been even more severe than that, and it depended. I mean, as you know, the pandemic didn't hit some parts of the state as hard, and what you see and the people influences your behavior. So.
Well, no question about it. So Jeff, what you got a game plan?
Well, I know you saw what part of what sparked your interest in this was that Detroit news story talking about, what the decline is going to be for fiscal year 2020. And the game plan is that by tightening up, by not filling positions and, between the temporary layoff days for state employees and lots of ways that we're trying to, cut back, we can still sustain the road building program in 2020. But 2021 is going to be more problematic. The governor is still committed to her Rebuilding Michigan plan, which, she announced early in the year before the pandemic, and the State Transportation Commission authorized the state to sell $3.5 billion in bonds. We still plan to go to market for some of those, maybe 400, 500 million this year. Some of those projects that'll be funded have already started, and they'll be reimbursed with that bonding money. But a lot of those are still going to go forward next year, 2022, 2023. Significant work on 96 and 696 in Oakland County, major rebuilding of 275, major stretches of 275 in Wayne County. You're still going to see, when we all wake up from this, it's not like the needs went away. Our roads are still what they were, and the reason that the governor ran on that, and it became kind of a national story, her success running on fixing the damn roads. Still very committed to that, and we're hopeful the federal government will come through. I'm sure you saw the news. Oh, go ahead, Dan.
No, go ahead. Carry on, please. Continue.
Yeah, you saw the news probably that the Michigan Municipal League held a Zoom call with Representatives Dan Kildee and Fred Upton from St. Joe, Republican, Dan Kildee, a Democrat from Flint, who and Dan's the major sponsor on what would be the fourth phase of stimulus money. That and this time it would go to cities and states, and the state would get a significant chunk of that. And he seems confident that in July the Senate will be able to move on that. We think that a big portion of that will go to roads and bridges.
Well, that's good news, and we do need the money. And, you know, moreover, our municipalities, they've been hurt. Their revenue streams have been annihilated as well the state of Michigan and, you know, and our schools. And there is no local or regional or statewide remedy to these problems. The federal government's either going to step in and help out, or we're going to have a really long struggle on our hands. So we hope that's the case.
Right.
We hope that's the case. No, go ahead.
Yeah, the federal government is going to have to come through here. I mean, it's been hard already. I mean, the federal gas tax hasn't been raised since 1993. You know, what else can you buy for the same price now that you paid in 1993? And it's just it's long overdue. And maybe this spurs the administration to really look at long-term infrastructure investment and how it can pay dividends, how it can put people back to work in the short term and the long term. You know, in a New Deal kind of way, like Peter DeFazio, the head of House Transportation in Congress, he's a Democrat from Oregon. He has made this, you know, he's equated this to the Great Depression and the need to think in terms of investment now, putting people to work that pays dividends. And
well, there's so many challenges that we have in this current political environment. But, you know, the one thing that at least sits out there as a possibility is a greater likelihood that infrastructure investment will be made, given the current environment, our current president, current Republicans, and current Democrats, because there's always been such a very clearly defined divide, and that's a lot grayer right now. We only have a minute or two. We'll spend some more time on another day. I appreciate you taking time with us, but we only have a couple of minutes. Why is it that it's, I scratch my head here because I'm perplexed. Why is it that it's so hard to keep our roads in good shape in Michigan? Is there something with our weather or some reason why it seems that we have a harder time with it? Or is it just we're not spending as much money?
We're not spending as much money. I mean, certainly, you know, Ohio has similar soils. It's not completely surrounded by Great Lakes and not half underwater like Michigan is. I mean, definitely the Great Lakes giveth and they taketh away. They present tremendous opportunities for us in terms of recreation, in terms of, you know, quality of life, but they also present some big challenges when it comes to things like building infrastructure. So yeah, our soils, you know, mostly clay on your side of the state, mostly sand where I live on the west side of the state, mostly rock up north. It creates all kinds of unique challenges, but other states have those and they deal with it. But, you know, Ohio spends $1 billion more a year than Michigan does. And it really comes down to investment. We've underinvested for decades. It's that simple. And, you know, all of the past governors have said that, but none of them have had any real luck agreeing on something big with the legislature. It's going to take something big.
Hey, has the possibility, and I'm sure this debate's been going on for a long time, I've just not been exposing myself to it, the possibility of toll roads getting a greater level of possible acceptance here in Michigan? It seems that people of Michigan have not wanted them over the years.
Well, a bill requiring MDOT to hire a consultant and study tolling over the next couple of years made it out of the Senate back in January and was poised to make it out of the House Transportation Committee yesterday. They canceled that. As you probably know, they canceled all session because of protests in Lansing. So that'll probably happen soon. And the whole House is expected to vote on that. And there'll be a significant study like we've never done before on the feasibility of tolling and what roads would it make sense and where could it be supported in Michigan. So that is actually in the discussion now in a way that it hasn't been, you know, since the early 50s when Michigan had a turnpike commission and abandoned it and decided that tolling, you know, wasn't for Michigan. So
will the governor, I mean, you're close to this, will the governor sign that if it gets to her desk?
I think that she is supportive of a study. Yeah, that would not be the same as supporting tolling, but saying that we should definitely look at it, yes.
Okay. Anything else people around the state in the next minute and a half absolutely need to know about MDOT or our roads?
Well, I think, you know, just remember that people that have been driving have stayed on the roads. You know, you've seen the stories from around the country of the incredible speeds and the way people are driving, you know, 80, 90 miles an hour because the roads are clear and it creates a mindset. We're going to go back to some sense of normal, and we already are, and those people are still out there working, and they're going to be working all summer long. So think about those people. Those are your, you know, wives and husbands and brothers and sisters and neighbors that are out there working on the roads, and those private contractors. It can be very, very dangerous work, working alongside of traffic. So try to keep that in mind.
Always a good reminder, and I'm about a half a mile away from all the I-75 construction that we see each and every day, and all the other construction around the state. Take it slow and around those workers as you travel this summer. Thank you very much, Jeff, for spending time with us. And what I really like are those sports posters that you have behind you. Clearly, you are a big-time sports fan, as I am as well. So good to see.
Those are, when the Free Press did those front pages as posters a few years back, I snatched those up. So, yeah, they're pretty cool.
All right, very cool. Thank you very much. Thanks for joining us via Zoom. He is Jeff Cranston, the Director of Communications, Michigan Department of Transportation. Good luck with everything, Jeff.
Thank you.
Tyler, well, there you go. We have been all over the state today with the Secretary of State, the Department of Transportation, talking about our unemployment issues here in the state. And just a reminder that we do all that appropriately from Jeff in the midst of a lot of activity in Lansing. In fact, so much protesting going on that the legislature is not in session today. So a lot of work going on to solve all these problems. Difficult times require very, very, very effective people in government, and hopefully we got the right people to get us through this mess.
I would hope so, too. And I think that when things start to calm down a little bit and they're able to get back in session, I would hope that they're working on a variety of these issues, including what we spoke to today with Mr. Cranston about the road issues and our other issues as well, including the education system and including especially unemployment, a huge issue right now. It's not getting its due response, I believe, and I know you believe, from the government as well. There's still a lot to be taken care of, but there's a lot that we're focusing on, both you and I, civilians, and the government as well.
Okay, I think we don't have time to do our regular wrap up, if you will, of the COVID-19 vocabulary. We got 2 minutes, so that we're not really going to have enough time to do that. But I do want to thank all of our radio and television outlets for being with us again today. We really didn't take an opportunity earlier when we hit our 60-day window to thank everyone that's been tuning into the show and thank all of our outlets for carrying the show. We really appreciate it. It is a labor of love to produce it. We got a great team, including our producer, Jeff Ryan, who is working on video editing and production behind the scenes every day. Erica Jones, who's been doing a great job with our reports in the field. Jake's been doing a great job at social media. Tyler, all the work that you've been doing. And then there's and Larry Nyland, of course. I think we're the only show in the world that has a Zoom producer, and he does so many other things behind the scenes where we're hitting all the buttons. So everyone is really appreciated, and most of all, we appreciate you for tuning in. And Tyler, what is unique about this is we have an opportunity to go find the stories that are happening on such a local basis, and out of that, hopefully glean some information about what's going on, and at the very least, take an opportunity to remind all of you tuning in the things that we face, the challenges that we face, and the actions that we as individuals can take to help make everything a little bit better.
There's always something more that we all can be doing, and I agree with that, with what you say, Dave, and I think that we're all trying to figure out what effort we can put into all these different issues so that we can make our best impact.
All right. Do you think you guys can run this show without me tomorrow?
Oh, yeah. Oh, yes.
Yeah, maybe a little bit better, actually. So Tyler Keefe is going to be here tomorrow at the helm. I know I'll be back on Monday. We have so much in front of us and so much to deal with, and we are not going to give up on this unemployment issue either. We'll be hard at work at that next week.
Yes, we will, Dave, and we thank all of you for tuning in today. This has been the Megacast.